2 rescuer CPR. When additional rescuers are available, 2 rescuer CPR can be performed. One rescuer provides chest compressions, while the other provides ventilations. For adults without an advanced airway device inserted, such as an endotracheal tube, 2 rescuer CPR is performed by giving 30 chest compressions and 2 ventilations. When performing 2 rescuer CPR on a child or infant without an advanced airway device inserted, give 15 compressions and 2 breaths. When performing 2 rescuer CPR on an infant, the 2 thumbs technique is preferred for compressions. Encircle the chest with your hands and place your thumbs on the sternum. Give 15 compressions and 2 breaths. If an advanced airway is in place, rescuers provide compressions and ventilations independently of each other. The rescuer giving compressions provides continuous compressions at a rate of 100 to 120 per minute, and the rescuer providing ventilations gives 1 breath every 6 seconds. Skill: back blows for adults and children. Stand behind the person that is choking and slightly to one side. Reach across the person's chest by wrapping one arm either over the person's arm or under their armpit. Place the palm of that hand on the person's upper chest or shoulder. Leave your other hand free. Have the choking person bend over at the waist to a 90-degree angle so that their upper body is parallel to the ground or floor. If they are not bending over when the jolt of the back blow dislodges the object may become stuck deeper in the airway. Using the heel of your hand with your fingers up, firmly strike the person between their shoulder blades. Give 5 back blows. If the object is not dislodged, get into position to perform abdominal thrusts. Skill: adult and child CPR and AED use. When breathing has stopped, the heart will too. CPR and an AED can help save a life. For CPR, use a mouth-to-barrier device to prevent disease transmission whenever possible. Use the RABCAB mnemonic to remember what to do for CPR. R stands for responsive. Tap the person's shoulder and shout, "Are you okay?" A stands for activate EMS and get an AED. Shout for nearby help. If someone responds, have them call 911 and get an AED while you start CPR. If you are alone and the person is an adult, call 911 and put the phone on speaker mode so that you can prepare to follow the dispatcher's instructions. If a phone is not available, leave the person to locate a phone and get an AED. If you are alone and the person is a child, give 5 sets of 30 chest compressions and 2 breaths before calling 911. B stands for breathing. Place the person on a firm, flat surface. Take 5 to 10 seconds to observe the person from the neck to waist for movement, rise and fall. If the person is not breathing or only gasping, continue to the next step. C stands for compressions. Move enough clothing away from the chest. Place the heel of one hand in the center of the person's chest on the lower half of the breastbone. Place the heel of the other hand on top of the first. Interlock the fingers of both hands to keep your fingers off the person's ribs. The heel of your hand should be the main point of pressure on the chest. A child, use one hand. However, depending upon the child's size and your size, 2 hands may be necessary. Position yourself directly above the person's chest so that your arms are directly above your hands. With your arms straight and elbows locked, push hard and straight down on the breastbone at least 2 inches on the person's breastbone with the heels of your hands. Allow the chest to fully recoil after each compression. Do not lean, rock, bounce, or jab on the chest. Do not stop at the top or bottom of a compression. When performing CPR, deliver 30 compressions at a rate of 100 to 120 per minute. It may be easier to push to the beat of the Bee Gees song, Stayin' Alive, which is 100 beats per minute, or to the beat from a CPR smartphone app. A stands for airway. Open the person's airway using the head tilt chin lift maneuver. B stands for breaths. Pinch the person's nose shut and make a tight seal with your mouth on the mouth-to-barrier device or the person's mouth. Give 2 breaths, each lasting for 1 second. Do not blow too forcefully or for too long. Take a normal breath for yourself after each breath. Watch for chest rise to determine if your breaths go in. Allow for chest deflation after each breath. When an AED becomes available, use it as soon as possible. Turn on the AED. Open the pads and attach them to the person's bare, dry chest.
Look at pictures on pads. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture.
Pictures on the pads will show where to place them. One pad should be placed on the left side of the chest, left of the nipple, and above the lower rib margin. The second pad should be placed to the right of the breastbone, just below the collarbone and above the right nipple. After applying the AED pads, stay clear of the person. Make sure that no one, including yourself, is touching the patient. Say "clear" and follow the AED voice prompts. Allow the AED to analyze the heart. The AED will prompt one of 2 actions. 1. Stay clear and press the shock button if advised to deliver a shock. 2. Do not give shock but give CPR, starting with chest compressions. Continue using the AED and CPR until the person moves, begins to breathe, or wakes up, or until EMS takes over. Understanding the human body. 2 severe emergencies, heart attack and stroke, affect the circulatory system and occur most frequently among older adults. Heart attacks occur when the blood supply to part of the heart is severely reduced or stopped, usually because coronary arteries become blocked. Early recognition and treatment of heart attack offers victims the best chance for recovery. Chest pain or pressure is the most common symptom of a heart attack. The pain may radiate to the arm, neck, jaw, or back. Other signs and symptoms can include shortness of breath, rapid or irregular heartbeat, nausea, vomiting, sweating, or fatigue. Heart attack victims should rest in a comfortable position with any restrictive clothing loosened. Assist with medications such as aspirin and nitroglycerin according to your local protocols. Stroke occurs when the blood supply to the brain is disrupted, often when cerebral arteries are blocked or ruptured. Healthcare providers can use a stroke assessment tool to determine the likelihood of a stroke. Signs of stroke include sudden onset of severe headache, weakness on one side of the body, facial droop, or abnormal speech. Victims of stroke should rest in a comfortable position with any restrictive clothing loosened. Victims are best treated at the nearest hospital offering emergency cardiovascular care.
Resuscitation adjuncts, AEDs. The heart is a muscle with 4 hollow chambers that pump blood throughout the body. An electrical conduction system coordinates its regular rhythmic action. Complications from heart disease or other sudden events like electrocution may disrupt the heart's normal electrical activity. The result is abnormal heart rhythms, disrupted circulation, and potential cardiac arrest. The two most common abnormal heart rhythms are ventricular fibrillation, or VFib, and ventricular tachycardia, or VTach. Ventricular fibrillation is chaotic, uncoordinated electrical activity. VFib results in quivering of the ventricles instead of strong, regular contractions. Ventricular tachycardia means the heart beats too fast. In VTach, the heart beats at such a rapid rate that it cannot pump blood effectively. Because both VFib and VTach respond to defibrillation, the earlier an AED can be used, the greater the chance a patient will survive. Automated external defibrillators, AEDs, are devices that analyze the heart rhythm, determine the need to shock, and deliver a shock through cables and pads adhered to the chest. Types of AEDs vary from basic units that laypeople can operate to AEDs that have more advanced features helpful to healthcare providers. All AEDs have common features, including the ability to turn the unit on and off, cables and electrode pads to attach to the patient, voice prompts such as "stand clear" to guide users through the procedure, and the capacity to analyze the heart rhythm, deliver a shock when needed, and store and retrieve data.
Do not touch the patient. Analyzing heart rhythm. Please wait. Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. Start compressions.
AEDs are simple to operate. With only a few buttons and voice prompts as a guide, using an AED is easier than giving CPR. Regardless of the AED make or model, all units follow the same basic steps. Turn the device on. Apply electrode pads to the patient's bare, dry chest, analyze the heart rhythm, and deliver a shock if needed. AEDs can be used on patients of all ages, from infants to adults, as long as the patient is unresponsive, not breathing, and without a pulse. Perform CPR until an AED is ready to be applied according to your protocols, and then follow the prompts. It may be necessary to use a razor to remove excessive chest hair so that the electrode pads properly adhere to the chest. Perform 2 minutes of CPR immediately following the administration of a shock. Whenever using an AED, follow the established procedure for your device. Some devices are semi-automatic, requiring you to push a button to administer a shock. Other devices are fully automatic and administer the shock. You should be familiar with the operation of your specific AED so you recognize its prompts and can check or correct unexpected messages. Some of the prompts your device may provide include a "no shock" advisory, analyzing interrupted, check electrodes, and replace battery. Using an AED requires awareness of some special situations so you can take appropriate precautions and action. These special situations include use of AEDs around water, the age of the patient, trauma, and patients who have medication patches or implanted defibrillators or pacemakers. Whenever the patient is near water, quickly move the patient out of standing water, dry the chest, and apply the electrode pads. As long as the chest is dry and the pads are firmly attached to the chest, there is little risk of any shock to the healthcare provider. Cardiac arrest in children is usually caused by an airway obstruction or breathing problem. AEDs can safely be used on children. If your device has specialized pediatric pads, use them. If such pads are not available, you should use the regular adult pads. Cardiac rhythms like VFib or VTach are rarely present in cardiac arrest from trauma. Trauma victims need immediate transport to a trauma center. The cause of cardiac arrest in victims of trauma is not usually associated with the kind of heart rhythm that would be helped with an AED. However, when in doubt, it is better to use the AED than not. No harm will be done by using the AED, but it would be highly unusual for a trauma victim to be saved by the device unless the cause of the trauma was originally a sudden cardiac event. If medication patches are on the chest, remove the patches and wipe the skin clean before attaching the AED electrode pad. Modern pacemakers and internal defibrillators can withstand the shock from an AED without problems. If you notice an implant like a pacemaker or defibrillator, apply the pads at least 1 inch away from the implanted device. Inspect your AED periodically to ensure that it will function properly and that you will have the supplies you need whenever you respond to a cardiac emergency. Supplies that you should periodically check include unexpired electrode pads and fully charged battery, a razor for shaving a victim's chest before attaching electrode pads, and a towel to dry the chest if necessary. AEDs run their own internal diagnostics to make sure the device is working properly. Each AED has its own unique way of indicating to the user that it is ready for use.
Skill, Infant CPR. Use the RAB-CAB mnemonic to remember the CPR sequence. R stands for responsive. Tap the bottom of infant's foot and shout their name. A stands for activate EMS and get an AED. Shout for nearby help. If someone responds, have them call 911 and get an AED while you start CPR. If you are alone, call 911, perform CPR, and then get an AED. B stands for breathing. Take 5 to 10 seconds to check for breathing or only gasping by observing the infant's face and chest movement. If the infant is not breathing or only gasping, continue to the next step. C stands for compressions. Place the infant face up on a flat, firm surface. If possible, use an elevated surface such as a table or cabinet top. Single rescuers can use either the encircling thumbs technique or the two-finger technique. If the rescuer cannot physically encircle the infant's chest, use the two-finger technique. To perform the encircling thumbs technique, place both thumbs on the lower third of the infant's breastbone, just below the imaginary nipple line, and the fingers encircling around the infant's back and chest. Then give 30 chest compressions. Push hard, about 1.5 inches straight down, and push fast. Use the beat of the Bee Gees song, Stayin' Alive. At the end of each compression, let the infant's chest come back up to its normal position. To perform the two-finger technique, place the pads of 2 fingers on the infant's breastbone, with one touching and both below the imaginary nipple line. Then give 30 chest compressions. The rules for the two-finger technique are the same as for the encircling thumbs technique. Push hard, about 1.5 inches straight down, and push fast. Use the beat of the Bee Gees song, Stayin' Alive. At the end of each compression, let the infant's chest come back up to its normal position. A stands for airway. Open the infant's airway using the head tilt-chin lift maneuver. Be sure not to tilt the head back too far. It will be less than for an adult or child. B stands for breaths. Breaths are an important part of infant CPR and should not be skipped. Cover the infant's mouth with a mouth-to-barrier device if possible. If not possible, cover the infant's mouth and nose with your mouth and make an airtight seal. Give 2 breaths, each lasting 1 second to make the chest rise. Take a breath for yourself between giving the 2 breaths. Continue providing CPR until one of the following occurs. 1. The infant begins breathing. 2. EMS arrives and takes over. Or 3. You become physically exhausted and are unable to continue. If another person is available, trade off about every 5 sets of CPR, 2 minutes.
Skill, responsive adult or child choking, abdominal thrusts. Signs of choking are when an adult or child cannot speak, breathe, or cough and may be clutching the throat. Clutching the throat is the universal distress signal for choking. Ask the person, "Are you choking?" Shout for help to alert others of the emergency. Give abdominal thrusts. Standing behind an adult or standing or kneeling behind a child, wrap your arms around the person's waist. Locate the person's navel with a finger. Usually right-handed people will use the left hand. Make a fist with the other hand. Right-handed people will usually use the right hand. And place the thumb side just above the person's navel and below the tip of the breastbone. Grasp the fist with your other hand. Thrust the fist into the person's abdomen with a quick upward motion. Each thrust should be a separate and distinct effort to dislodge the object. Use chest thrusts on a choking, very large person or pregnant woman. Continue without interruption until the person coughs up the object, speaks, moves, or breathes, or until EMS or a trained person takes over. If the person becomes unresponsive, give 30 compressions and 2 breaths. Before each first breath, look into the mouth for an object. If an object is seen, remove it. If the person is found unresponsive, perform all the CPR steps of RAB-CAB. When giving breaths, if the first breath does not cause the chest to rise, retilt the head and give a second breath. If the second breath does not make the chest rise, begin CPR by giving 30 compressions followed by 2 breaths. Each time before giving a first breath, open the person's mouth and look for an object. If an object is seen, remove it. Continue sets of 30 chest compressions and 2 breaths until an AED becomes available. Patient assessment. Sudden cardiac arrest can occur at any time. If the patient is motionless, tap the patient on the shoulder and shout to see if he or she responds. If the patient responds, he or she is said to be responsive. If the patient does not respond, he or she is said to be unresponsive. If the patient is unresponsive, check for breathing and a pulse at the same time for no longer than 10 seconds. If the patient is unresponsive, is not breathing normally, but has a pulse, the patient is in respiratory arrest. Open the patient's airway and begin rescue breathing. Provide rescue breaths at a rate of 1 breath every 6 seconds for an adult. If the patient is unresponsive, is not breathing normally, and is pulseless, the patient is in cardiac arrest. Begin CPR starting with chest compressions. Apply an AED as soon as it is available to analyze the heart rhythm and determine the need for a shock.
Stay calm. Follow these instructions. Make sure 911 is called now. Remove white square package from lid of AED. Tear open white package across dotted line and remove pads. Peel one of the white pads completely from blue plastic. Firmly place the pad without the blue plastic on patient's bare chest, exactly as shown on pads. Next, peel second white pad from the blue plastic. Firmly place the second pad on the other location. Do not touch the patient. Analyzing heart rhythm. Please wait. Shock advised. Do not touch the patient.
If a shock is advised, make sure no one is touching the patient. Follow the prompts.
Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. Start compressions.
Note, some AED models deliver shock automatically. Always follow the manufacturer's directions that accompany the AED. Continue CPR and defibrillation until help arrives or the patient starts to move. Knowing what to do in the first few minutes may mean the difference between life and death.
Emergency cardiac care and the healthcare provider. Each year, sudden cardiac death claims hundreds of thousands of lives. Lay rescuers are often the first on the scene, providing basic care until healthcare providers such as paramedics and EMTs take over care and transport the patient to the hospital. Once at the hospital, more advanced healthcare providers, including physicians, nurses, and physician assistants, provide both basic and advanced care to give the patient the best chance for survival. In this program, you will learn how to recognize a heart attack, cardiac arrest, stroke, and choking, how to assess a patient's condition, and how to provide care that can help save a life. This care includes providing cardiopulmonary resuscitation, commonly called CPR, as well as the use of an automated external defibrillator, commonly called an AED. A person's heart might stop beating for a variety of reasons, including heart disease, near drowning, electrocution, drug overdose, or trauma. Without prompt and effective care, permanent brain damage can occur within a few minutes. After 8 to 10 minutes, brain damage may be irreversible. In emergencies involving cardiac arrest, both lay and professional rescuers play critical roles in the events known as the chain of survival. The chain of survival for out-of-hospital cardiac arrest has 6 links. 1. Activation of emergency response. 2. High-quality CPR. 3. Defibrillation. 4. Advanced resuscitation. 5. Post-cardiac arrest care. And 6. Recovery. The chain of survival for in-hospital cardiac arrest care also has 6 links. 1. Early recognition and prevention. 2. Activation of emergency response. 3. High-quality CPR. 4. Defibrillation. 5. Post-cardiac arrest care. And 6. Recovery. A common fear associated with emergency care is contracting a disease such as hepatitis or HIV from blood or other body fluids, or tuberculosis from airborne droplets from a cougher's sneeze. Healthcare providers can minimize the risk of disease transmission through the use of standard precautions, such as wearing medical exam gloves and using barrier devices like face shields or face masks during resuscitation. Resuscitation adjuncts, airway and ventilation devices. Ventilation devices can be used to minimize the risk of disease transmission. These devices include face shields, resuscitation masks, and bag valve masks. When using a resuscitation mask, such as a pocket mask, position the mask so that it covers the nose and rests on the cleft of the chin. Maintain a good mask seal and give normal breaths through the one-way valve at a rate of 1 breath every 6 seconds. A bag valve mask requires the rescuers to maintain a good mask seal and squeeze the bag. The bag valve mask is most effective when multiple rescuers are available. One rescuer uses both hands to hold the mask on the patient's face, while the second rescuer provides ventilations by squeezing the bag. There are 3 rescue airway devices commonly used for adults: the iGel supraglottic airway device, the King airway, and the laryngeal mask airway, sometimes abbreviated as LMA. Each of these devices is designed to be inserted into the mouth without visualization of the vocal cords. Each device has an inflatable cuff that provides a patent airway, allowing for adequate ventilation during CPR. If you are providing oxygen to a patient, you will need to be sure the unit is assembled properly before use. Using an oxygen wrench, briefly open and close the valve to clear any debris from the cylinder stem. A metal or plastic washer, commonly called an O-ring, creates an airtight seal between the regulator and the cylinder valve. With the O-ring in place, attach the regulator to the oxygen cylinder. Using the oxygen wrench, open the tank and check the pressure in the cylinder. Attach the desired delivery device to the regulator. Set the oxygen to the desired flow rate for the specific delivery device you are using. Check the oxygen delivery device before applying it to the patient.